Hi, I'm Heather Schmidt with Integrative Education, and I'm here with Rhoda Erhardt, occupational therapist. Her webinar is Visual-Perceptual-Motor Interventions for Developmental Coordination Disorders. Thanks so much for spending some time with me today, Rhoda. It's great to see you.
Thanks, Heather.
My first question for you is if you can give us a little bit about your background and your experience in relation to visual perceptual skills and developmental coordination disorders.
The reason I became interested in this topic is that I became aware of a fairly new diagnosis, developmental coordination disorder, and it was finally in the DSM-5, and so it has a lot of credibility. And when I started checking the symptoms, the behaviors, I realized that it was very similar to a topic that I have been involved in for many years, and that's visual motor perceptual issues. And I began to think these were also symptoms that were found in children with learning disabilities and autism, and quite a few others. In fact, when I went back into history, there were a lot of terms like neurological dysfunction that Dr. Heinz Prechtel talked about. I recognized some of the characteristics that Newell Kephart talked about, and this is going way back, but many of these research studies and assessments are still very valuable today. So I decided to really check this out. And one of the things I liked most was a chart that compared the similarities. So it was kind of like a little table with X's where several different diagnoses display those symptoms.
Thanks, Rhoda. Can you tell us a little bit more about what people can expect at the Lunch and Learn? And granted, it's only 1 hour. So if you can talk a little bit more about what you're going to discuss in that hour, that would be great.
Yes, I have a slideshow. I may use some slides to demonstrate what I'm talking about. I won't be reading the slides, but I'll be filling in with examples. I also will probably put in a few video clips to demonstrate the actual activities they use for treatment. I don't think I'll be saying much about the evaluation process because any evaluation can be used that's appropriate. And somebody might want to use something different than I use. And of course, we'll have references, so this can be pursued later. I do believe we're going to try to get a PDF of ahead of time. We're not sure about that. So it is very interesting because we can use the guidelines that I've been using with the visual perceptual motor in the workshops that I've taught for these children. Many of them are very appropriate. And so that's exciting. It really is. And I did make a poster that demonstrates all this. And as I said, I do have a slide presentation. But for this hour, I'm going to try to condense that so that it's meaningful and doesn't feel choppy. Let's hope we can do that.
Rhoda, who would you say would benefit from this class? Who's this class for?
Well, I've always felt that most of my material is appropriate for OTs, PTs, speech, teachers, sometimes psychologists, but of course this is geared for OTs mostly. However, I think that the other professions can get a lot of information that will be usable for them too. And I always keep that in mind when I'm trying to create a presentation.
Rhoda, can I ask you one more question?
Sure.
Can you tell us a little bit more? I know that some of the strategies that you're going to be discussing are things that you've developed and created over the years. And I'm wondering if you could just talk a little bit about the intervention resources that you are the author of that you're going to be kind of talking about and providing more context and information to the participants.
Yes. Many years ago, I started collecting everything I could about that topic. And I started gathering activity charts from many different sources. Barbara Knickerbocker, an OT from long ago, had some wonderful ideas. I looked online, but most of the material I used were things that I had collected over the years. And I made these charts to be graded so that they not only could measure how well a child did, but they could also be a guideline for teaching. And they were grouped into fine motor, gross motor, and ocular motor. And the charts, in my own practice, I use them to teach mainly parents how to do these things every day or 5 days a week with the children. We made some really nice progress. Now, if anybody wants to read more about this, I had a couple of published journal articles. One was about a 4-year-old boy, or actually there was a chapter that I wrote with an optometrist about the 4-year-old. And then there's more. There's a 13-year-old with handwriting problems that I use these charts with. And we had independent evaluations by his optometrist and his psychologist, and they saw really significant gains in the Beery test. So I kind of felt that I was on the right track. And so I've used it with a lot of other people. Now I eventually put that into a book. And so there is a book called the Visual-Perceptual-Motor Activities Collection. That's it. And so there's some published things. I can make those references available to anybody. And I also edited the videotape that I did the entire time with these children, because I videotaped them so I could send copies of the videotape to the parents so they'd have a reference in addition to the charts to follow the procedures. And just to give you a quick example of the kind of activities, one of my favorites for gross motor coordination was, it's on video too, I have a photo of the boy's dad, the 13-year-old, and they're out on my deck. And on the deck is a chalkboard with a circle drawn on it. And the boy is not only working on perception, but he's working on balance. So we put him against a deck rail and asked him to stand on one foot, and the other foot had a wet sock. So he didn't have to draw anything. He just had to race the circle and track along. And eventually we had him moving away from the deck. So we were able to see that kind of progress. So that was one of the gross motor things. And the fine motor, we did a lot of chalkboard. We didn't do handwriting at all because we wanted to do the foundation skills. And the ocular motor, we did some eye tracking. I remember the 4-year-old, we suspended what they call a Marsden ball from top of a doorway. It's kind of a light plastic thing. And then we gave him a rod, a wooden rod that had a left, right, and center printed on it. And so as he hit the ball, I'd say center, okay, right, and left. And we start out really slow, and we were able to speed up. And these are activities that children look at as fun. And so that's another main reason, because you get a lot of compliance from the child, and you get compliance from the parents when they see the improvement.
Mm-hmm. Awesome. Thank you so much, Rhoda. We are really looking forward to the discussion. Again, it's going to be on our website, www.integrativeed.com, to get registered, and we hope to see you then. Thanks so much again, Rhoda, for your time.
You're welcome.